So my name is Pennie Carnes. I practice at Cuyuna Regional Medical Center. I'm a licensed professional counselor. I'm certified as a sex addiction therapist. I also am trained as an alcohol and drug addiction specialist. I work with folks that obviously have addictions and in their families as well. Everyone seems to be affected by addictions, and so I work with the family. I am trained in trauma. So through that, I have special training with EMDR, which is eye movement desensitization and reprocessing. Menopause can bring on hormonal changes. And with these hormonal changes, our brain is also changing. The information processing system of the brain, it's changing as our body is aging. So with EMDR, what we're doing is connecting the right side of the brain to the left side of the brain so they talk to each other. And the trauma, the experience, the negative belief systems become less intensified. Let's think of it this way. The right side of the brain is creative. Think of music and writing and art. The left side of the brain is science and math. And the right side of the brain is where our traumas lie initially. And the rumination starts, which means thinking and worrying about these over and over and over and not being able to let go of it. And then the feelings intensify and the behaviors start, negative behaviors start from this. So with EMDR, we actually do what's called bilateral stimulation, and that means moving the right side over to the left. And the process is the therapist would move their fingers right to left to have the eyes move. If that is problematic to the patient, we can use tappers, which are an instrument that you hold in your hand, and they beep. They just have a silent beep, and so you can feel it from the right to the left. If that's a problem, we can even tap on the knees. Just anything to move that brain from right to left and get the hemispheres to be talking to each other. Symptoms such as anxiety and stress, night sweats, hot flashes, low libido can cause harm to relationships. It can cause heart feelings because of the mood swings that are happening as well. So with EMDR, we can't take away the symptoms because that is a physical symptom because of the hormonal changes. But what we can do with EMDR is to less intensify those belief systems. So that, let's say, for instance, a woman in menopause is having these odd behaviors. They're being irritable. They're angry. They have bouts of depression even, low libido, even painful sex. So with the EMDR, we're able to lessen and intensify those feelings, move it over to the left side where it's more logical, and it's something they can cope with. When people come to me for EMDR treatments, and they often ask, how many sessions is this going to take? I have no way of really telling them. It has to do with how fast they're going to process the information, how deep the trauma wounds are. But let's take, for instance, it's menopause, and there's not really any trauma that's been involved with their life. Then we would be able to put them in what's called a safe, calm place. That is a place that when you're having these negative feelings come up, you can say a word. And we pair that word with feelings, with using your five senses. What did I think? What did I hear? What did I touch? What did I smell? And they're able to have just a wave of peace that flows over them. And through this process, it just lessens those symptoms that they're having to where it's something they can manage and cope with in a more peaceful way. Clients can reach me by just calling the hospital directly. Or to self-refer, or in the case of the clinics, I have many providers that refer me to them.